Hi, this is Dr. Choi from iGrow Clinic. We're going to learn how to do Omnitrope Pen injection today. Let's get started. These are the items we need: Omnitrope Pen, cartridge, needle, alcohol swab. The cartridge needs to be refrigerated at 36 to 46 Fahrenheit. This is 2 to 8 Celsius. Please do not freeze the cartridge. Once you start using a cartridge, it must be thrown away 28 days after the first injection. Every time you take out a cartridge from the refrigerator, leave it at room temperature for 15 minutes before you inject. It might feel uncomfortable when it is too cold. Please do not leave the cartridge out in the room temperature for more than 30 minutes. It needs to be discarded after 30 minutes. Let the cartridge sit in the room temperature. In the meantime, you can wash your hand and assemble it. Unscrew the pen device. Put the cartridge in and screw the pen until the blue arrow lines up with the white line mark. Now take a disposable needle and tear off the paper tap. Screw the needle onto the pen until the needle will not turn anymore. Next, gently pull off the outer needle shield and put it aside. You will need this later. When you're using a new cartridge for the first time, you need to prime the cartridge, which is a process to take out the air. You only need to complete this step one time, so next time you use the same cartridge, you can do the injection right away without priming. Hold the pen with the needle pointing upwards and those windows facing you. Slowly turn the dose knob in a clockwise direction until you hear one click. The arrow will be pointing between 0 and 0.2. Now carefully remove the inner needle shield. With the needle still pointing up, firmly turn the dose knob the other way back to 0. When you do this, you should see 2 drops of liquid flow out of the needle. If you don't see 2 drops of liquid, repeat the priming step again until at least 2 drops of medicine appear at the tip of the needle. Now it is ready for injection. Find your child's dose. It is written on the box you received from the pharmacy. If you're switching from vial to pen, here is a simple technique for conversion. Multiply 0.05. If the dose for vial was 30 multiplied by 0.05 equals 1.5. This means your dose is 1.5 milligram. If the dose for vial was 48 multiplied by 0.05 equals 2.4. Then your dose is 2.4 milligram. In any case, if you cannot find your dosage on the medicine package from the pharmacy, and if you're not sure of the dosage, please send a message or email the clinic. Okay, let's say the dosage is 1.5 milligram. Hold the pen with the needle pointing up. Turn the dose knob in a clockwise direction until the arrow points 1.5. In this case, it is in between 1.4 and 1.6. If you turn the dose knob past 1.5 by mistake, instead of going backwards, keep turning the knob forward till the end to reset the pen. Then you can start again. You can choose the body size to inject: buttocks, belly, backside of the arms, or thighs. If it is your first time, maybe try buttocks or belly first. For belly, please try 1.5 inch away from the belly button. Please do not inject the exact same site over and over. If you're injecting the same body site, pick a site an inch from the last injection site. Swab with the alcohol, let it dry. Unless it is a buttock where there is a thick fat layer, you can pinch the area with the opposite hand. Hold the needle at a 45 to 90 degree angle from the skin. When you put the needle in, go in fast without hesitation. Put the needle all the way in. After inserting the needle into the skin, press the injection button slowly. Remember, the solution is a bit thicker compared to vial. It might be uncomfortable when the solution is injected too fast. After the injection is finished, instead of pulling it out right away, continue to press firmly on the injection button for 5 to 10 seconds to make sure you give the child the full dose of medication and prevent the medication from seeping out of the injection site. Pull out the needle, carefully replace the outer needle shield, unscrew the needle from the pen, and dispose it in the sharps container. Place the cap onto the pen, put it in the refrigerator right away. Please do not leave the cartridge out in the room temperature for more than 30 minutes. You don't have to take out the cartridge until it is empty. You have 28 days to use up this cartridge. Once it is empty, please dispose it in the sharps container as well. Now let's talk about what to do when you don't have enough medication left in the cartridge. For example, let's say your dose is 1.5 milligram. Each cartridge is 10 milligram. So you know after 6 days you don't have a full dose left, but you will still load 1.5 milligram and do the injection. If the injection button stops in the middle of injection, take a note of the number shown in the dose window. You will need this for your second injection. In this case, it is 0.5 milligram. This means you need 0.5 milligram more to finish your dose. Discard the first needle and cartridge and load the second cartridge and a new needle. Since it is a new cartridge, you will need to go through the priming process as we learned earlier. After priming the new cartridge, load 0.5 milligram and repeat the injection. This will conclude our training today. If you have any questions, please call, email, or send a message. Once you receive the medication from the pharmacy, you can start the treatment for your child. If you'd like to have an in-home nurse training, please call OmniSource. Please let the clinic know when you're starting the treatment so we can schedule a 4-week follow-up appointment. Thank you.